These dogs are parts of our family for the most part. We want to do the best we can for them throughout their lives to make sure that they're healthy, happy, and that that quality of life is good with us too. And we certainly will do the good prevention things such as vaccinations and heartworm prevention, and then we'll treat diseases as they come. Well, the mouth is important both on the prevention side and the disease treating side. As we look at dogs, we can see a lot of periodontal disease problems. Periodontal disease is where you have the plaque in the mouth with bacteria. You can get the tartar, you can get everything going on. It causes an infection, and that's something people understand definitely. There may not be acute pain, but there can definitely be some discomfort. So it's not just bad breath, it's not just doggy breath. This infection can cause enough inflammation that we can lose gum tissue, bone tissue, end up losing teeth. But you already mentioned how important it is to the rest of the body. It's not just about the mouth. That infection and inflammation in the mouth can impact the rest of the body. And while it's not the best way to find out, sometimes I had a 15-year-old poodle come in today that they're a little bit worried about anesthesia, but the dog's mouth is horrible and now he's got this huge swelling. So we'll do very good care under anesthesia. We'll probably have to pull most of his teeth, but I have no doubt that at the 2-week visit, they're going to come back and go, oh my gosh, she is feeling so much better. We can't believe it was just the teeth, because it isn't just the teeth. It impacts the rest of the body.
Are there certain breeds that are more prone to dental disease than others that you've seen?
Absolutely. So I usually tell people if they bring in a puppy that they plan on it being 25 pounds or less as an adult, say 10 kilograms if you have an international viewing audience. Number one, start good dental care early. Number two, if you can find an insurance company that covers regular dental cleanings, do it. Sooner or later, you're going to have problems with that dog. Since I'm a specialist, I get the ones that are more advanced, sometimes older. I see a lot of little old dogs with severe periodontal disease. In fact, another little dog I saw today, her jaw is broken due to bone loss from the periodontal disease. It possibly happened in December. This dog is still eating, but when you go to touch her,
Wow.
she's in discomfort. So we're going to get her in. We're going to work on that. We're going to work on her other teeth and make her a lot happier and healthier. So it is extremely important. Small dogs, especially brachycephalic dogs, anything with a short, flat face. So sometimes you'll have a small brachycephalic breed, definitely an issue. But even boxers and bulldogs can have issues. And then on another side, if we give hard chewing objects to dogs who are even bigger or smaller, that can break teeth. So they may love those antlers and the bones and everything that's, really takes a long time to chew through, but those hard objects can also break teeth. So we usually like chew toys that are bendable or compressible. So those are two of the biggest issues we see with dentistry.
Yeah, wow, that's really interesting. I always actually wondered about that because some of those toys are just so tough on their teeth. But I always assume that they would know more than I do. That's their own teeth, but I guess they don't.
Well, the thing of it, like dogs are pretty tough. Like that little dog with the broken jaw, she's still eating. Okay.
Yeah,
And especially if they can get it in between the carnasal teeth, the upper fourth premolar and lower first molar, and really just the PSI of their jaws is beyond anything human dentists have to deal with, and they see broken teeth from chewing on ice cubes. Well, and then pit bulls are in a whole nother territory with the amount of strength they have in their jaws. So we see a
yeah.
lot of interesting dental issues.
Yeah, I bet. Wow. Dr. Heidi, what would be some of the more subtle signs of dental disease starting to occur? So you mentioned, the plaque and the tartar buildup. Are there stages before that we could actually be looking for to, know that we need to actually start taking some different actions to take care of their dental health a little bit better?
Right. So, certainly bad breath is going to be an issue, because that as the bacteria get worse in the mouth, they actually produce sulfur. So I was joking about doggy breath before. It's amazing though how many times, like that little dachshund, she's probably still giving them kisses because it's changed gradually. All right. So that's why I talk about dentistry being a team sport. Within the dental practice itself, veterinary practice, we have the technicians who really help out the veterinarians, but there's also the owners. So, what we try to do is educate them from a young puppy age on, especially those small breed dogs, to see if they can do home care. All right. So, if they're doing some home care brushing or wipes, and now we're starting to see more debris on it, or maybe there's bleeding. Bleeding shows that there's inflammation in there. Then it may be time for a good oral exam, and the American Animal Hospital Association recommends that, especially those small dogs, get their first dental x-rays and cleaning done by 1 to 2 years of age. Because sometimes, even with the young ones, there's hidden problems that we can't see without taking x-rays. Unripped teeth, malformed teeth, things like that. So if you're really following them from puppyhood on, getting them used to good home care, regular exams, and to be honest with you, regular dental procedures, which, yes, does take anesthesia. But once we get in there and take the x-rays, sometimes we'll see problems we had no idea that they were happening, because dogs are tough. They may not show a lot of stuff that you may not realize.
My next question is, are there any specific diet related changes that we could make, or well, probably a better question first is, are there any specific diets or things that we're giving to our dogs that are actually causing dental disease, and are there changes that we can make to actually help that as well?
Well, there's a number of studies that even shown differences between wet food and dry food, kibble and things like that. But the key is we need to go with good formulations of diets. I'm going to put a little plug that's non-dentistry here, what we call the BEGs, the exotic diets, the grain-free, things like that. We're seeing some heart disease with dogs with that, so we try to avoid those. There's actually a list of diets and treats available that have gone through some testing, and it's on a website called Veterinary Oral Health Council.org, VOHC.org. And these products have gone through some testing. So there are some dental diets. Some of them have a little bit bigger kibble. So when the dog chews through it, it helps kind of squeegee those teeth. Of course, that's going to be mainly the ones in back. And if you have a dog that's a gulper that doesn't chew his food, it's not going to make much of a difference. But there's also some diets that have hexametaphosphates on them. So even though you build up the plaque all the time, that soft plaque, it can be brushed away. You can't brush away calculus or tartar. So this helps slow down plaque turning into tartar. And then there's certainly specific dental treats, again, either working with mechanical abilities as they're chewing on the treat, or sometimes some mild chemical abilities. The gold standard is brushing, which I'll admit, I'm not the best brusher out there, but I can take my pets in and get the teeth cleaned on a regular basis. Brushing or small dogs' dental wipes, things like that. So as we're looking at what we can provide the patient in a passive manner, some of the diets, some of the treats, but the active events of brushing and wipes and things like that can be definitely helpful. And then avoid the hard objects. That may be one of the few times that a dog really yelps out in pain, other than having facial trauma or maybe a large tumor. But if they suddenly break their tooth on that antler or that bone and the pulp is exposed, that's when dental disease can be suddenly painful. Now that pulp won't hurt after a few days after the pulp dies, but then when he gets the abscess swelling underneath the eye, then that will be uncomfortable as well. So I took a little bit of tangent there. I hope you don't mind.
What are the tips that our dog owners can be doing? So you're recommending brushing, which I think every single dog owner out there would like to do it more often than what they do. There's also these new products where they're sort of like a toothpaste with like the little thing for your finger. Do those types of things work as well? Are they recommended, but something that you'd recommend?
And as you're looking at you actually, there's so many ways to do home care with brushing, with wipes. Water additives can help the breath a little bit, may not do as much for actual disease. But we also have to pair the correct level pet to parent rather, because especially if you go take a regular toothbrush and try to brush your vicious cat's teeth, you might end up in the hospital. You don't want to do that. Starting them early, getting them used to it, coming from behind the head and with wipes or brushes, doing like that versus aggressive from the front. Many of the toothpastes have a little bit of an enzymatic effect, so that helps out as well. So even being in the mouth can help out a little bit. And the key of it is, even as humans, if we brush and floss, brush twice a day and floss once a day, we still go in and get our teeth cleaned on a regular basis because there's still going to be those deposits that build up, and we still need to have hidden problems checked out. But by getting your dog used to early home care, having their face handled, doing the brushing and the wipes, even other grooming things, their ears, their feet, things like that, you've now set them up for good preventative care. And if you start noticing something, like I say, if you're doing the wipes or the brushing and you notice a little blood, or you're doing the wipes or brushing and where the dog had been comfortable before, now they're flinching in pain, something needs to be checked out.